Cape Breton, majestic and welcoming island. Famous the world over for its magnificent coastlines, friendly people, and rich Celtic, French, and Mi'kmaq heritage, Cape Breton offers two unique family medicine residency training experiences. On the island's northeast coast, Sydney is home to a block-based program based in part out of Cape Breton's Regional Hospital, the second busiest healthcare center in Nova Scotia. Partway up the island's west coast in the Gaelic heartland of Inverness, residents gain longitudinal rural medicine experience in a close-knit community. No matter which Cape Breton location you choose, you'll receive unparalleled one-on-one teaching in comprehensive family medicine from dedicated preceptors.
There are so many great preceptors who are very enthusiastic about teaching, and they just really want you to succeed. Typically, you're the only other resident on service, and so you get a lot of one-on-one time to ask questions, to be supervised doing procedures, and given that, you become quite confident and quite proficient.
In the Sydney program, residents encounter many high-acuity cases in the emergency room and ICU. Cape Breton's population is relatively elderly, with high rates of chronic disease, and there is a large First Nations population as well. Residents learn how to manage complex comorbid conditions and how to provide culturally sensitive care. There is so much variety, residents are well prepared for anything.
Here in Sydney, there are so many different family doctors who have varied practices that involve clinic work, hospitalist medicine, and also small procedures. There are several clinics such as youth health clinics, well women's clinics, and addiction clinics, which really permit you to have clinic work in areas of your interests.
In Inverness, residents look after patients' everyday concerns, as well as more acute situations, and they often have to prepare severely ill or injured patients to be transferred to tertiary care.
You have to make sure you actually stabilize them for the transport that can last 2 hours to 4 hours, because you have to make sure that patient is going to remain stable for the whole duration and that their life is not going to be actually endangered by the transportation.
Inverness also offers extraordinary opportunities for residents to work independently.
So for my resident program, I've created a new resident-led clinic for unattached patients. So basically, it provides family care to patients that don't have a family doctor, instead of them either going to the emergency department. This opportunity allows now the resident to work in that clinic and have a little more independence and have a greater sense of ownership of some patients.
In spite of its remote location, Inverness residents get a lot of exposure to specialty disciplines.
During the course of the program, we go to Sydney to do rotation in a specific field of practice. The first year we go in for obstetric and gynecology. On the second year, we go for palliative care and ICU. Besides that, residents are encouraged to go back to Sydney for elective. We also have the opportunity to work with specialists that come and visit the Inverness Hospital for a day clinic. These specialists are in cardiology, rheumatology, hematology, oncology, ENT, and gynecology.
Whether you train in Inverness or Sydney, when you complete your residency, you will find lots of practice opportunities in Cape Breton.
There are a lot of opportunities for young family physicians. There's a lot of senior family physicians that are eager to retire in the next few years. There's availability in emergency medicine and hospitalist medicine. There's availability in addictions medicine. There's availability in the youth health centers at our local high schools for adolescent health. Transitioning from residency to practice in Sydney was really quite easy.
Cape Breton provides the perfect blend of personal and professional opportunities.
Sydney is a great sized city. It's big enough to have pools, great fitness facilities, great restaurants, and there's also a university. It's also small enough that you get to know all of the family doctors in the area and also all of the specialists. I already feel like I'm a valued member of the professional community here.
There are a lot of activities available for families in Sydney. There's a lot of outdoor activities such as skiing and hiking, biking, golfing. We have the famous Cabot Trail and small communities that encourage tourism throughout the year. There's also a lot of sports in the community such as soccer and hockey that will keep you very busy.
There are also many great bodies of water around that you can explore, such as the Myra River, and you can kayak, you can sail. There's just so many ways to explore this great island, and Sydney just offers so much opportunities.
If you're looking for excellent training and abundant opportunities in a spectacular location, choose Cape Breton, Inverness, or Sydney in the next CARMS match. Choose Cape Breton, Nova Scotia. Choose Dalhousie Family Medicine.